Welcome. Today we have Dr. April Calderon joining us to talk about the direct primary care model of medicine. We've seen a lot of movement that way from private practices moving to the direct primary care model. And as an insurance agent, I see this kind of supplementing some of the insurance that we do sell that are high deductible health plans with no copays. And also there's some companies out there that have started offering direct primary care med as part of their basic plan. So by joining their coverage, they give you that access to a direct primary care doctor. We have one company here in Austin that does it. So today I'm excited to kind of share how the direct primary care model works and how it's a little different. And we have Dr. April Calderon here to kind of explain those models. Please welcome Dr. Calderon. So thanks for taking the time today. I know she's very busy.
Thank you for that introduction.
So tell me, where is your Euphoria Health located?
We have actually two locations. One location is down in Central Austin on 38th Street, and then the other location is in Cedar Park off of Little Cottonwood Creek Trail and 1431. So right off of that 183A toll road. It's the first exit off, and then a street down past all the big shops.
And then you're in the Cedar Park office?
And I'm located in the Cedar Park office, and actually my husband is located in the Central Austin office.
Oh, very cool. So maybe you can tell us a little bit about the direct primary care model.
Sure. So direct primary care is a membership-based primary care that results in increased accessibility and longer visits. And I have gotten to have firsthand knowledge of what the opposite of direct primary care is, which is a traditional insurance-based practice. In that practice, I was seeing 20 to 25 patients a day. I tried to spend more time, but usually only had about 5 to 10 minutes to spend with each patient. And the reason I had to see so many was to keep my overhead low. But in this type of practice, I have one other staff member in the office with me. I am able to spend more time with my patients because I have less patients. And then I get to help them out with things that they've been either meaning to get to or more preventive health. And really help them save money on labs and imaging because I'm knowledgeable about the medical system.
Oh, that's pretty good. So it's a pretty much more intimate, non-rushed visit. So you don't have to feel like, oh, I got to get to my next patient so we can spend time. So I guess you really get to know your client or your patients.
Right. I think that's generally how I think family practice works the best is having that personalized care, really knowing what treatments your patients would prefer. Most of my visits are anywhere from 30 minutes to an hour. It's not very, or it's very common to spend more than 30 minutes with a patient. And most of the time I hear that is the most time I've ever spent with a doctor. I love to educate. I love to personalize kind of their wellness plan so that they feel like they're involved in their care. But also it's great for me because I get to have that relationship and we get to build on that trusting relationship.
And I love that it's customized for each individual. It's not the same plan for everybody that walks through the door.
Yeah.
Because of the way you practice medicine. Some of the things that you do in the direct primary care model, talk about the things that make you different than probably the traditional doctor. We talked about the non-cookie cutter, but other things that you do.
So, one big difference that I wasn't able to do in my last practice is have video conferencing, text visits, phone visits, email visits. I have the availability to be able to communicate with my patients through multiple mediums, and then also in the office if needed. Other things that you get a benefit from joining the direct primary care, which are discounted labs. So we don't mark up our labs. I get a certain lab rate from some of the bigger labs. We use CPL, and those labs get discounted 90% for me, and then I pass that savings on to my patient. So that
cool.
Adult panel may be $25, whereas if you just went into an office, that might be around $300.
you can do some procedures in the office, and the ones you can't, you refer out. Is that?
Yeah. So I generally, as a family practitioner, I've been trained in lots of things, but I pride myself in skin procedures. I took a lot of time in residency and then did some training afterwards. So just last week, I removed a squamous cell carcinoma, which is a skin cancer, from one of my patients, and saved her a trip to the dermatologist, saved her that extra money that she might have spent. And I can do those in office, laceration repairs. So a lot of the acute procedures I can do as well.
And so with those procedures, is there extra charge associated with your office, or it's included in your monthly?
Yeah,
fee?
actually, thank you for asking that. It's included in the membership, in the monthly membership charge, because again, I, as a physician who can do and has been trained to do many things, I'm able to offer that to my patients, offer those discounts, but I don't mark up my procedures.
That is cool. I love that there's one fee that gives you, I guess, unlimited access to you.
Unlimited access.
And then you can take care of some of the basic stuff. I think the model is fantastic to help people get access and take care of themselves better, because they're not having to worry about how much is this going to cost me. I applaud you for this model and you explaining that to my clients and anybody else that's considering direct primary care. I love the philosophy of it. I hope that you have much success with your practice, and if you want to see Dr. Calderon, go to that Euphoria Health and you can sign her up to be your doctor, and she'll take care of your personal needs. So I really appreciate your time. I know you're very busy, but I thought this would be helpful as we see more and more of the direct primary care model coming.
Definitely. Yeah. And any questions, please feel free to call. The number that you can call is on the website, but that number is 737-215-4525.
I really appreciate all your time, and thank you so much for sharing your time and your direct primary care model with us.
Yeah, thank you for taking the time to interview me.
All right, thank you so much.
Bye.